Hello everyone. Before we get started, I would like to let everyone know that attendees do not have a microphone feature on this webinar. If you have any questions, please utilize the chat box feature or the Q&A feature, and we will answer questions at the end of the webinar. Thank you. Our first speaker is Ms. Nadia Ochoa from the Palmer Drug Abuse Program. Nadia Angelica Ochoa graduated from the University of Texas Pan American in December 2002 with a bachelor's in communications. In 2003, she began her career as the Resource Development Manager for the Food Bank RGV, where her responsibilities included overseeing the volunteer program, food drives, and their direct mail campaign. Under her leadership, the development department grew, and she was afforded the opportunity to oversee staff that would manage products, which ensured they were reaching and exceeding their goals. After a few years, she wanted a change in her career, so she applied and became the first assistant director to annual giving for the University of Texas Pan American Development Department. It was an amazing opportunity with an incredible supervisor who was a great role model for her. In fact, the office she worked in was full of talented professionals, so she learned a great deal from everyone. When she accepted the executive director position at the Palmer Drug Abuse Program in 2014, she knew it was a great organization, one she could believe in and be passionate about. 3 years later, she is still here, and she still feels the same way. The organization's success is attributed to the outstanding staff that is diligent in working towards their mission every day. They are currently working on a special project with McAllen ISD in hopes to start the first recovery high school here in the RGV. Thank you so much for joining us, Ms. Nadia.
Good morning, everyone. Thank you so much for having me. My computer went off for a split second, so I missed most of that, but I mean, that's no big deal. So if my computer goes off, I apologize in advance. I'm actually in the building with the best internet, so I don't know what's going on there.
No worries.
So thank you again. And I'm here today. Our topic is road to recovery. And, you know, there's not really one road to recovery. It's kind of like winding paths to recovery because no one person is the same as someone else. Here, I'm going to talk about a little bit what we do here at Palmer Drug Abuse Program and in the way we help people to recovery. And then I'll discuss other ways and other options for people that are on their road to recovery. Palmer Drug Abuse Program, we've been here over 30 years in Hidalgo County. And what we do is we provide free substance abuse peer recovery counseling to anyone in need. And we started age 12. Now, when I first started, I was like, age 12, there's no way we have 12-year-olds that are addicted to drugs or even abusing drugs. That's too young. But since I've been here almost 8 years, we've had a few 12-year-olds and even some as young as 10. So it is an issue. We do try to help the best we can, but in some cases, most of these cases, especially, we have to refer out to other agencies. So what we do is we provide services through individual counseling and group counseling. We do individual counseling during the day, and our groups are held in the evening. So we have 3 specific groups. We have our younger group program, which is ages 12 to 17, 18 if they're still in high school. And then we have our family support program, because what we've learned here during all our work is that it's really hard for someone to get sober and then going back to the same family environment, right? Something that might be triggering them is going off at home. And if we don't help the family, it's really hard to help that individual. And then of course we have adult group. We 18 and older, and I'm talking about all ages. There's no age limit to addiction. We have older adults that have been in recovery 18 plus years, and they're always good resources for people that are just starting out. When I say peer recovery, we're not a clinical site. So if someone needs rehabilitation in the sense of inpatient care, that's not what we do, but we are able to refer out to other agencies that do provide those services. Unfortunately, in the Valley, we don't have that many places. There's less than a handful. And so a lot of our referrals are out Corpus Christi, San Antonio, Austin. We have to refer out pretty far. I hope in the future that there are more facilities here in our area, because I guess our culture and our demographic here they really don't want to leave, to get help. They really want to be close to their family. But sometimes you just have to do what's best for you to get help. Our counseling and our group services are all based on a 12-step program. I'm sure some of y'all might have heard that before, a 12-step program. AA, there's Alcoholics Anonymous, NA, Narcotics Anonymous, Al-Anon for families, even Alateen for teenagers. Those are for loved one, for people that have loved ones struggling with addiction. These are all 12-step programs. Ours is just a little different since we started at PDAP itself. The organization started out in an Episcopal church in Houston. Ours are more geared to younger group, right? But even adults use our 12 steps. It applies to everyone. But when they first started, it was just providing services for younger group. Through our 12-step program, people are able to work these steps and maintain and get to sobriety. Now, sobriety doesn't happen overnight. A lot of addictions, you can't even go cold turkey, especially alcohol. If someone's addicted to alcohol, a lot of severe alcoholics can't just stop. They could get very sick and even pass. So there's always different levels of when it comes to getting treatment on your road to recovery. Now, the best part about PDAP, all our services are completely 100% free. There's no fee, there's no charge to come in to get help. And the best part besides that is that you are able to get information on, even if we're not the site for you, even if you don't like what's going on here, or you're not into the way our services are provided, we can refer you to a different facility. Our goal is that anybody walks into that door, we're going to help them in some way, even if it's just a referral to another rehab, detox. A lot of people are struggling with addiction.
Oh, okay.
I'm so sorry, y'all. I moved
No worries.
a room closer to the internet, and this is as close as I can get. It's literally right next to me. Sorry about that.
No worries.
As I was saying, mental health is huge right now. A lot of people are dealing with it. We've seen an influx in addiction because of it. So we are working very closely with other institutions that provide services for mental health, and we're able to do those referrals as well. It's very important, besides the times that we are in right now, to have those relationships with other organizations, because like I said before, we're not always the right fit for every client that comes into our door, and we want to have those options available to refer out to them, and to know what's available in our community. So I'm sure that's why you're having this huge health fair, is to learn about other organizations and other services provided in our area. And that's what we do constantly as well as an organization, to make sure we know what's out there besides our facility to help others. We want to really also acknowledge the importance of family support on the road to recovery. I mentioned it earlier in my presentation about how it's really hard to change someone struggling with addiction and them having to go home to the same family environment. And this just means we want our families not only just to support their loved one going through addiction, but also to understand, right, what addiction is. It's not a choice. A lot of people would never choose to be an addict. And it's definitely a disease. So with understanding that and other, things, the selfishness that comes with it, not even knowing what they're doing to their loved ones and how they're hurting, it helps families build and strengthen themselves to cope with what they're dealing with, and especially with other younger kids in the family that might not understand what addiction is, and how it's going to affect them. So we really focus a lot on the family dynamic. We do a lot of motivational interventions as well here at PDAP, and just to get our clients excited about recovery and motivate them to want to get sober and stay sober. It's really a hard job. We have 5 counselors here, and coming in and out at all times, just to provide enough services to the community. Let's see what else. What people don't understand on your road to recovery with different organizations that you might be working with, and networks or support systems, there comes a time when someone on the road to recovery needs to move on, right? The counselor that they're with isn't, working out for them, or the location they're at isn't working out for them, and they need to seek other services. And we're here for that as well. We're also probably a secondary source for a lot of clients that have gotten out of rehab or out of detox. They come here afterwards. We're like a support system to that. Recovery is lifelong. So there's not some magic, remedy one day, the light bulb turns on and you're good to go for life. No, it's a lifelong battle. You'll hear people say, like, I have 22 years of sobriety, 30 years of sobriety. So that was like a choice that they made 30 years prior to change their life around, and because they were struggling. That's what PDAP supports: complete and total recovery, complete and total abstinence of substances. So we don't believe in that California sober where it's like, okay, we'll just smoke pot. No, we don't do that. It's complete abstinence from all chemicals. So it's really important to understand that it is a lifelong battle. So if you have someone or a loved one struggling with addiction, it doesn't get easier as years go on. I mean, it's a struggle every day that they deal with. So it's very important to always continue to support them and give them the strength that they need to continue every day. So every road is different when it comes to recovery, but we are here to help in that journey, and we're here to support our community in that journey as well. So if you have a loved one or yourself, might be struggling, and it doesn't have to be, every day. You're using substances that you're not supposed to be, or you're drinking every day. It's when it's affecting your life. If it's affecting your work, if it's affecting your family, if you're getting in trouble, that's when you have a problem. And so we're here to help. And if y'all have any questions, I'd be happy to answer.
Thank you so much, Miss Nadia. So I do just want to thank you so much, for your really informative presentation. We know that struggling and dealing with drug addictions or substance abuse is a very important topic that doesn't get a lot of light shed on it. So we really appreciate you being here today to discuss such an important matter. So we will now open up the presentation to our audience for a Q&A. You can either utilize the chat function or the Q&A chat feature as well that we have via Zoom. Sorry, this phone is ringing. So yes, does anyone have any questions? So we do have one question. Are any of these services covered through our insurance plan? So Ms. Nadia, just for reference, we do have Aetna insurance. I know that, I don't know, do y'all use insurance plans?
Actually, like I mentioned, all our services are free, so you don't even have to worry about insurance. We also have an anonymous program, so we don't even contact like your employers or we don't contact your insurance either. So you don't need a referral from a physician. You literally can just walk in or give us a call and set up an appointment. That's the best, like one of the best things about our organization. As far as insurances, Aetna, I know, is a really good insurance. And so if you were to have to be referred out to a detox or a rehabilitation center, Aetna Aetna is typically a good insurance to where they would accept it. My counselors are more familiar with that. However, like I said, Aetna is a pretty good insurance. It just depends on your deductibles and what your limit is on mental health and addiction services.
Thank you so much. So we do have one other question. Where can we find a detailed list of all of the information available, such as phone numbers or a website?
So I know on our little booth that we created is our information, our phone number, all that good stuff. And as far as like organizations and rehabilitation centers that we refer out to and utilize, we actually have a list. We work with UTRGV and we have great interns that come in every semester and update this list for us. So if you just give us a call, we could email it to you. So we do have a list of rehabs, detoxes, and facilities, inpatient care facilities that we've created on our own.
Excellent. So they would be able to visit your vendor booth that you do have here on the virtual platform.
Yes, ma'am.
So you said that does have your list of phone numbers as well as some other flyers, correct?
Yes, ma'am. And just, give us a call. One of our things, one of our programs that we really pride ourselves with is our younger group. And I didn't talk much about it and I apologize, but our younger group, we have group twice a week, Tuesdays and Thursday evenings, but we also have what we call a rebos, which is sober spelled backwards. Every other week we do an activity. We'll go to the zoo, we'll go to the movies, we'll do a highway cleanup. We've done that. Just different activities to get our youth group that is in recovery out into the community and give back. So it's a great program if you have someone that's young. And when they're young, it's really easy to get them back on track. Kids make mistakes. We live close to the border. And so, drugs are very prevalent in schools, in their peer groups. And so there's a lot of temptation and there's a lot of curiosity. So it's really easy to, get kids back on track and get them on the right path. And that's what we're here to do. We do have an after school program. So we do provide transportation. So we are able to pick up kids directly after school on Tuesdays and Thursdays and bring them to our site. And we do a little like snack and activities after school as well.
That's wonderful. That's really great that y'all are so interactive. You have these programs available. We do have another question. What is the best way to approach the subject to someone with alcohol addiction? Hi, everyone. So I just wanted to jump on here again for a second. I do appreciate the other questions that are coming in. Hopefully, Miss Nadia will get her signal back. In the meantime, though, just wanted to highlight a little bit of what Miss Nadia was saying in regards to her online booth. So we do have her virtual booth. She is our Palmer Drug Abuse Program is a vendor on our online platform. So we encourage everyone to visit our online vendor booths as well as our online other features. There are many ways to win prizes on our virtual platform as well as our in-person platform. So I do encourage everyone to visit. You do get points for visiting the webinars, for finding all of the hidden objects in the throughout the event pages. You can find all of these points tallied up in the leaderboard section, which you'll find in the lobby. There's a doorway that leads to a leaderboard. Here you'll be able to find your name as well as how many points you've accumulated, and you'll be able to see how you can win, how you can accumulate more points. So we do encourage you, because at the end of each day, the top 10 individuals on the leaderboard do win a prize. So we do encourage you to gather as many points as you can, find all the hidden objects, participate in the trivia. The trivia questions are related to the webinars as well as the wellness program. So we do have quite a few opportunities for y'all to win some great prizes. So well, we'll give it till 2 more minutes and then, or 1 more minute here, and then we'll go ahead and see if she's able to log back on. So is this also free to family and friends? Yes, so I do believe that the Palmer Drug Abuse Program is a community, the Palmer Drug Abuse Program is a community program. So they are available to anyone in the community, whether they are children, adults, the elderly, they are utilized by the whole community. I would go and visit their vendor booth so that way you can see exactly what programs they do have for each age group, because it is a wonderful program to have here in the Valley. And we do, encourage everyone, if you know someone, if you feel like you might be in need of help, we do encourage you to utilize their services. Again, she did say that they do use insurance, so I would just see about which insurance either your family has, your friends, whether they're on your insurance, so that way they get hopefully the best care that they can get. To answer Miss Pat Ramos's question regarding what is the best way to approach the subject to someone with alcohol addiction, oh, look, she's back on. Perfect. I was just going to encourage everyone to visit our Wellness Exchange episode where we did interview Miss Nadia Ochoa on alcohol addiction specifically. So she did answer this question, and she was able to really give us some great insight into how to approach this subject with someone regarding alcohol addiction. But I'll go ahead and let her take the floor with this question. So, Miss Nadia.
So sorry, everybody. What's even worse is I have a board meeting with my board of directors at noon today. So I'm like cringing and hoping that my internet will work for my bosses. So like the question was, how do we approach someone struggling with alcoholism? So definitely when they're sober, do not approach them while they're incapacitated. You don't want to attack them when they're drunk or using alcohol. And then it's a very delicate situation because if you don't know the severity of the addiction, you might not be able to, they might not be able to stop immediately. So you would have to really come from a loving place and let them know you're concerned and that you care and that you want to help them. And then from there, you can definitely encourage them to, like, hey, why don't you just try this place and talk to somebody? It's becoming an everyday thing. I'm worried about you. If you come from a very positive, loving place, they're more receptive. However, they might not be either. So if you see that there's, pullback, stay positive. Don't give up, because a lot of times people have to hit the rock bottom before they're ready to move on and get help and to acknowledge that they might need help. So just stick with it and let them know that you're there for them, that you care, of a place that, just try it out. Just getting clients in our door, you can see a big change. Some of them feel relieved almost that they're able to, like, you know what, this is a problem. This is an issue. There's an underlying something that happened to them, maybe, you never know. So just staying positive, coming from a good place of, caring and love. And if that doesn't work and they get upset with you, just stick with it. Don't give up on them. Whatever you do, don't give up. When they're ready, they'll know that they can come to you, and they'll know that they can trust you. So just don't give up. And if you need help, give us a call. We do have, like I said, we do motivational interventions. So if we can get the family together, maybe sit them down and let them know that, there's more people that are concerned about it.
Awesome. Okay, awesome. So I don't think we have any more questions. So that would just about wrap up our webinar. So thank you everyone for your participation. This does conclude our first webinar of the 2022 Hidalgo County Employee Wellness Fair. Again, I want to thank Ms. Nadia Ochoa for her time here and for the
And I'm
wonderful
so
information.
sorry, everybody. I
No
apologize. My internet is so embarrassing. I am so sorry.
worries.
We
No
are a
worries at all.
nonprofit, but it's Spectrum, so it's not us. Thank you so much.
It happens. It happens. But I just want to invite everyone to be sure to check out the rest of our online platform or join us in person at the Precinct 2 Indoor Sports Complex. If you have any questions, message us through our chat feature. We are a vendor as well, or email us at hidalgocounty.wellness@co.hidalgo.tx.us. Thank you so much, and we'll see you soon.